with about 1 million hospitalizations for heart failure every year. You know, we were so excited when some of the early, often single-center trials were showing that telephone data was going to be really helpful. Then the multi-center trials come along and they were neutral at best. Definitely disappointing. But the concept here is using telephone-generated data to improve CHF quality. Is this our future? And the question is a very good one. So I am here with Dr. Kapadia and Linda Tavares, who is a DNP and an RN, and you had this session here at the CV Summit. It was disappointing. I mean, we had the early data, everything seemed great, and then it all fell apart at the seams. At that point, were you kind of, what has happened here?
Well, I think what we have to look at is that we're at a amazing junction or nexus, if you will, of the demand of healthcare and technology plays, and that realizing that technology is the enabling tool, but it really requires the high-touch piece to impact behavior and outcomes.
And we know that a lot of those hospitalizations are for rehospitalization, and there are things that if you had only known a little ahead of time, hopefully you could have prevented a hospitalization. Is the technology there finally where we think that we're going to make a difference?
I think the answer is yes, but it's not just the technology piece, it's the human interface piece. And in the data that we've collected in the study that we're getting ready to publish, we demonstrated that the technology is great, but if you don't have the human interface that can really synthesize all that noise, all those data points that come in, and make some meaningful determination out of it, then it's really just noise and it's not useful.
Well, some of the studies seem to suggest that the doctors weren't really paying attention to the data that came in because they were too busy doing other things.
That's a great point. So what we want to do is take all this data, filter it, analyze it, and then deliver it to the physician in an actionable way that's meaningful and contextual, rather than doing a data dump, which is probably part of the failures of previous studies.
So how does this work?
So how this works is when patients leave the hospital and they have a diagnosis of either heart failure or myocardial infarction, they are connected with our team C3 Nexus, and that includes a monitor that is a wearable monitor. They also have a blood pressure cuff and a scale. All of that data goes into a lockdown cell phone. We call it a remote because we have a lot of elderly patients. And then that comes with a health coach. And a health coach is a virtual term basically that includes an RN. It's all RN driven. Also a health and wellness coach, and there's some IT support as well. And we put the monitor on, we do medication reconciliation, we do food reconciliation, because most people, as long as they're sitting in the magic bed, eating the magic food, taking the magic pills in the hospital, they're fine. They get home and things kind of fall apart. The coach then becomes very connected with this patient telephonically multiple times during the day, we found, particularly in those first couple of weeks, to making sure that they're doing their weights, they're taking their medications, they're eating what they're supposed to, they're going to their doctor's appointment, all of those kinds of things. So it's definitely a bi-directional communication between the patient and the coach.
And I think that's important because some of the data that we are aware of that has failed, there has not been that bi-directionality. It has been very much, it comes in and falls into a big pot, and whatever happens to it there. So this makes a difference, is what you're saying.
Oh, absolutely. I think what we have to do is change the paradigm of care delivery from episodic care and population management. Population health is a term that gets loosely said, but it's really about going from discrete visits to continuous care and shifting outside the usual care ecosystem so that you can deliver the right care at the right time, the right place. And a lot of that can be in the home. Driving office visits isn't always necessary, and now we can lever technology, video, to deliver virtual visits. And so that reduces the cost of care delivery. Using a team-based approach that helps support the physician also reduces the cost of care, and it enhances outcome and behavior change. And what you're doing now is, instead of treating to the mean, you're treating in a targeted, individualized, tailored approach that can really use, the patients can see their own data and drive behavior change that way.
And we also know from other data that, and in other settings, that the fact that you have someone coming back to you, text messages are fine, you can get some advantage from that, but when there is an actual human being interaction, that seems to propel the data even forward more.
Correct. It also builds great confidence in self-care. So we actually, in our study, used the Self-Care of Heart Failure Index to demonstrate that. Patients had access to their coaches 24 hours a day, 7 days a week. Interestingly enough, they did not abuse that. They called appropriately, and there was that great communication. And through that communication and their ability to look at the data and be involved in the data of which they generated, the patients, it really propelled their self-care confidence to an adequate level.
So for doctors who have dealt with this project before and who have worked with it, what's the response to it?
Well, we did a pilot project at a hospital in Richmond, and we looked at 142 patients over 90 days. And we got incredible response because we really looked at the physician's workflow. We were very sensitive that we didn't want to dump a lot of data, nickel-dime them, so that we drove appropriate information back to the physician team. And so we were able to filter out probably 90% of the data, and then 10% became valuable. But what we also did is we created a situation where we flipped the clinic. So we took an office visit that typically you spend 75% of the time extracting data from the patient in a very excruciating way sometimes. So what we did now is we flipped the clinic, and now we armed the patient with their report of their My Health status. So now patients were engaged. Physicians have a summary of what's happened since their last visit, what are their trends and their vital signs, what are their behaviors, what's their adherence, what are the med changes. And now it's a dynamic conversation between the patient and the physician that really is relationship building and more of a partnership than a patriarchal visit. So the patient leaves engaged, ready to take action, and the physician, feels satisfied that this is a great visit and a meaningful visit.
But the flip side of that is some physicians now are starting to wonder, are we asking too much of patients when we're asking them to get so involved? At this particular point, you're not feeling like this is a big burden on either the doctor or the patient. Go ahead.
I would say no, because I think what we know is, and again, the population we're typically targeting are going to be the older folks, particularly for heart failure. And these are people that are turning 65 at the rate of 10,000 per day. Our baby boomers, they're very engaged. They want to be involved with technology. They want to be involved with their care. They're great consumers. They're really driving a lot of what we're seeing in healthcare now. So they really do want to be engaged.
Well, it is exciting because this is an area we really expected a lot out of, and then suddenly it just kind of seemed to peter out. You're saying that it's now time, we've turned a corner, and this actually may be the answer.
Oh, it's the perfect storm, a convergence of where we are in care delivery, our broken system, and where the opportunity lies on the technology side between smartphones and what smartphones can do, connectivity, the internet and the Internet of Things, looking at our computing power, which is crazy, and then looking at sensors to collect data. So if you think of us, we're like the human beings are like a black box. And so what we need to do is unlock all this rich information, because going to a physician and getting your blood pressure and your heart rate and EKG is just a snapshot of time. But our hearts are beating 60 to 90 minutes, 60 to 90 minutes times a minute. And so there's all this richness of physiological data that we can capture and then use to manage care. So why not take advantage of it? We do that with our cars. We have a check engine light, and we know when our car needs servicing. Right. It's a very proactive approach. We have to shift from take it to the doctor when it's broken to let's be proactive and preventative.